So I really want to say thank you, first of all, for everyone to attend, but also for the Center of Excellence and Joseph Munn to come as our guest speakers and specialists for tonight. It's such an important topic that we're going to be talking about tonight. And I will say it is deep in my heart because I am a mom to a child with FASD. So this information session and this learning, I'll be just as curious and in tune with what's going on as you guys tonight. So I'm going to go straight into it now. It is 8:03, so perfect timing. So Lisa, I'm going to hand it over to you. If you need anything, please let us know.
Thank you very much, Kim, and thank you to the team that invited us to do this presentation. Thank you to the parents who have joined tonight. I know it's taxing. I know at this time of the night that, you know, things can get a bit rough. So do bear with us. We really appreciate that. Tonight, I will be presenting Maria, who will also be my co-host. We have Nadia from the Center of Excellence, Tanya, and we have Joseph. Tanya will be presenting from a mom's experience, and Joseph will be presenting from an individual who diagnosed with FASD experience. So you'll get a mix of both. Maria and I we did have a much bigger presentation for you, but that's for another time when we get more of your time. Tonight, we're just going to keep it we'll try to keep within the hour so that you can get off as early as possible.
Can I iterate for 1 sec there, Lisa? I did forget to mention that not only do I hope you're very interactive tonight, but the staff from Center of Excellence and Joseph are extremely open to questions. So please use the chat, which if you're not sure where that is, go to the bottom of your screen. And if it doesn't show chat right there, click on more. And then you'll be able to put your questions in the chat. I will ask them for you when they finish a slide or take a pause, but please feel free to be as interactive as you wish. Sorry, Lisa, thanks.
You're welcome. So can you all see my screen? Now, I can't see most of you, so, okay. So tonight's session, we're on a topic of deepening your understanding of your child and how their brain works differently. We hope to present to you provide a platform for adoptive families to learn more about FASD and the Center of Excellence. We'll provide strategies, and that's coming from Tanya and Joseph, strategies to build on your child's strength, to support challenges related to FASD, and also give you information regarding common developmental learning and medical and behavioral issues that you may be experiencing. Now, all will not be the same, okay? So first of all, without even going into FASD, we need to understand what alcohol is. And alcohol is the use of alcohol beverage dated back in centuries among the population of between 15 to 49, and we're still seeing that even today. There are more than 200 diseases and injuries that are caused by harmful use of alcohol. It is a psychoactive substance, and more than 400 conditions concur with FASD. So prenatal alcohol exposure is regarded as a major public health issue. We do have 50% of women in Canada reporting consumption prior to knowing that they're pregnant, and we have a stats of 18% continue to drink after pregnancy. Alcohol is the most preventable teratogen in history. However, it is regarded as the only contributing factor for fetal alcohol as well as mental behavioral disorder. That being said, this is being said by it is preventable, okay? Now we want to speak on that just for a little. And we really here at the center, we don't use the word preventable, but I bring it on screen because you'll hear that a lot as you go through your daily life, right? It is not a case when we say it is preventable, we're looking at stigma. So if it is preventable, why did mom go and drink, right? But according to public health, it is preventable, but that's only in theory. In theory, it is. If you're looking at it from paper, it is. But when we socialize with alcohol, alcohol is in our daily living. Tonight, if I wasn't presenting, maybe I would be having some alcoholic beverages, right? Do I know that I'm going to get pregnant later tonight after I finish my drink? No. So we need to be very careful when we're saying alcohol is preventable. And I'm hoping that very soon public health will change that message and start using more positive, because that's really negative. And I brought that out. So just to give an explanation, okay? We're looking at 1.1 million over the lifespan just for one person that is spent out each year. So what is FASD? And I'm going to hand over to Maria at this point.
Okay, can you hear me? Can you hear me?
Go ahead, Maria. Yep.
Okay, so you can hear me. Okay, FASD is a diagnostic term used to describe impacts on the brain, but it's also the holistic, the whole body that is affected of people prenatally exposed to alcohol. It is a complex medical diagnosis and a lifelong disability. It is a leading cause of neurodevelopmental disorders, and we'll go more into that. Can you move forward, Lisa?
There.
So individuals with FASD will experience challenges with their daily living. That means every day is like a new day. Ongoing support will be needed throughout their trajectory of life so that they can attain their full potential. People living with FASD, each person is unique and they have both areas of strength and challenges. We wish that we had a magic recipe and we'd be able to say, if you do this, this, and this, you've got it. But unfortunately, that's not how FASD works. It is very unique. There is a higher risk of FASD in children who are adopted from countries where prenatal alcohol consumption is higher. So what does it look like in Canada? And what is the prevalence for New Brunswick? So it is the leading developmental disability in Canada. The rate of FASD in Canada is higher than autism, cerebral palsy, and Down syndrome combined. Bet you didn't know that.
So we have a question saying, how much alcohol consumption throughout pregnancy is associated to higher risk of FASD? Is there a threshold?
There is so little alcohol that can cause FASD. Today we were discussing, we had a clinic for a child and we were discussing with the pediatrician, Dr. Nicole Leblanc, and she was saying that the current research is even showing that even one drink could cause FASD. And that surprised me. You know, we always said like, it depends how much you put in the drink, but they're saying like just one standard consumption. So it's hard to answer that question.
Yeah, that's very surprising. That's very little. And then, like you said,
Very
you
little.
know, you could have a drink tonight and not know that you're
Exactly.
pregnant.
And that will be even more shocking when you see the following slides. Okay, so because most women do not even become aware of their pregnancies until several weeks after conception, that's why the risk of having FASD is quite high. However, we must be careful not to stigmatize women because it can be many weeks before they know they're even pregnant. And I have 2 moms that have come to clinic and they had been told that they would not be able to conceive. So it's not because it's never with intent. We don't know of any mom who would intentionally want to harm her baby. Alcohol is toxic and can adversely affect any organ or system on the baby. FASD is associated with a wide range of health issues, absolutely, including impaired vision, hearing, underdeveloped skeletal and limbs, and organ damage. And those damages are permanent. So just to compare and to tell you how high it is. So the autoimmune disorders, so for rheumatoid arthritis, is 12 times higher than the general population. Immune problems, chronic ear infections, 142 times higher. For asthma, it's 4 times higher. Heart defects, 23 times higher. Child's heart surgery, 15 times higher. Who knew all of this, right? Problems with bones, muscles, and joints. So scoliosis, 7 times higher. Osteoarthritis, 4 times higher. Vision, hearing loss among children, 75 times higher. The endocrine disorders like thyroid, hypothyroid, 160 times higher. Sleep disorders, 14 times higher, and seizures, 21 times higher.
My goodness.
And this is why before diagnosis, we are always checking, and even after diagnosis, when we're hearing symptoms, we're checking to see, could it be X, could it be Y, right? So it's it's a very complicated.
And more complex than we ever thought. Mm-hmm.
And that goes right into a question that we have again. Why is it so difficult to access services unless mom admits to drinking? What can I do if mom won't? Wait times for services are long, and this situation makes it even longer.
Just to compare to other provinces and across Canada, we are the only center of excellence east of Ontario. We are the only bilingual clinic in Canada. And we started, 9 years ago now? And we have one clinic. We had to start somewhere. There was nothing before. So we have this one clinic, but we are very limited. We only do 24 clinics a year. And we do what we can. But we're aware, and the government is aware. We have received some funding, and we hope to be able to expand. We want to do some satellite clinics, and we want to expand on our services.
And just to expand on what Maria is saying, so regarding the services, some clinicians, they're really new to FASD, and say for some OTs, they will not take a client with FASD because they do not understand or they don't know what to do, what therapies to offer, okay? Because they cannot offer the same therapy service that they'd offer to a general, to the general public. It would need to be tailored, specific to the needs of the individual with FASD, and most cannot do that. So that's another reason why services are limited. If they don't have if mom doesn't admit to drinking alcohol before she knew she was pregnant or during the pregnancy, then of course we could do a facial measurement, right, to rule out. If that's not, if we don't have any answers from there, we could check with if the child was with, or if mom was followed by the social service department, then we would be checking documents there to see if there's anything in the file that could give us a lead. So we don't just drop the case as soon as we hear that mom is not saying that, mom is not giving a confirmation, or you cannot get a confirmation from mom. If it is an international case, now that is much harder for us to track. And some of the documents internationally, they are very hard for them. Sometimes the documents that we thought would be available internationally, they don't have them because those are not documents that they keep. So it's a lot of dynamics that goes into cases when we're doing assessment for individuals who have been adopted. We don't take it very lightly. We do a lot of digging. That is why sometimes the file is sitting with us for a very long time. I hope that answers your question.
If we didn't answer all of your questions, just repeat the question that we didn't answer. So the common strength that we see, because we always want to start with the strength, because we know that it's with the strength that they are going to be able to succeed. Most of it is with the arts, vocabulary, work habits, sports, kind-hearted, artistic, very helpful, successful with hands-on, visuals, physical activities, and amazing strength in the face of adversity. They are very resilient. Lisa?
Yeah, I changed it. Can you see? I
Nope.
did. No? Look, can you
Oh.
see now?
Now I can. Thank you. So they are musical, pleasant, willingness to change. They will try as hard as they can. High school completion is a source of pride for the children with FASD. They are hopeful. They like performing simple tasks associated with daily life, and they do like repetition. They're compassionate. They like simple instructions and work best one-on-one. So with the alcohol, we know that there are changes that have happened because of COVID. There has been an increase. So with the alcohol, if you look at did not happen or do this before, 31%, decrease of 10%, the same 42%, and an increase of 17%. So we know that the alcohol has increased by 17%, cannabis increased by 10%, and household conflict, fighting amongst ourselves, increased by 18%.
And that's alcohol. So we have FASD mixed with trauma. So we are looking at complexity even more now, right? Yeah. Go ahead, Maria.
So more changes as well. So for 18 to 39 years old, it's increased by 32%. From 40 to 59 by 16%, ages 60 and up by 13%, single people 9%, couples only 19%, families 22%, previous mental health conditions have increased by 22%, and frontline workers consumption has increased by 25%. So we know that there is an increase. So before knowing that they were pregnant, from percentage of women who gave birth, 15 to went up. If you look at the screen where the red line is across the board, that's before pregnancy, the alcohol consumption, and then across the board at the bottom showing from 2016 to 2021. So it's just to show how the alcohol consumption is on the rise. It's not just accepted, and it's almost an expectation now. If you go to a party or if you go to a bar, everybody wants you to have that drink, even at supper, going out to a restaurant. So this is just to show you some of the traumas that the fetus, the baby, can have during the pregnancy. And so whether it's tobacco, the opiates, the caffeine, the alcohol, every one of those. I'm not going to go into those, Lisa, because of the time constraint. But if you have questions, we can certainly address that.
Yeah, we do. I just want to point out too in the comments that there's a few people supporting each other, saying that they're going through the same thing. And the person who asked a previous question about if a mom doesn't admit to it, they said in our case, mom admits to drug use, but not to alcohol. And then we do have another question that someone sent in to me, and it might be a good time to approach it now. It says, does New Brunswick NBFASD Center of Excellence use medical imaging, MRIs, etc., scans as part of the diagnosis procedure?
Not at this time. It's all done through testing by an occupational therapist, speech and language pathologist, the pediatrician, and the psychologist on our team. So there are many tests that are done, but not through imaging.
Not at this point, because we
not at this time.
don't have that as yet. We're not there as yet.
Okay, because I think that they finished it with saying browsing through medical imaging procedures better diagnose of the PAE related diagnosis than neurological testing, and it seems that it should be less time consuming and therefore likely to avoid multi-year wait lists. If no one here is familiar with this question, would it be possible to ask the presenter in advance? And that's what we're doing tonight.
Okay.
In the US, there are 8 places in the US that they do that. And I think their places, and it must be private, but I think they send it down to the US as well. So I was going to say Ontario, but it's private and it's mostly in the US or other countries, but not here, not in New Brunswick. We don't have that as yet.
Okay, thank you.
For the mom or the person that made the comment of they couldn't get the alcohol confirmation, sometimes it takes us a long time sometimes to find it, but we do try to leave no stones unturned. So we will go to social development. We've gone through police reports. We do try to get as much information as we can to try to get that alcohol confirmation. I have had some that I couldn't, but there's even some that we were very concerned that we wouldn't be able to get it. And then something came up and we did get a confirmation of alcohol. So don't despair. It could still happen.
Mm-hmm.
So look at the effects of the alcohol compared to the marijuana, cocaine, heroin, and tobacco. So the alcohol is the only one that causes the impaired growth, the facial malformation, and the small head size, which we call the microcephaly, and also the organ damage and birth defects, compared to the others. Okay, so different organs are in development at different times throughout the pregnancy, but the brain is the only organ that is in development throughout the pregnancy. So you have, okay, so here you have mom's last period is way at the top on the left, okay? So 14 days later, so she has the ovulation. If mom consumes alcohol between day 17 and day 22, that's the 5-day window that if mom consumes then that the child may have the facial features, but less than 10% of our clients have the facial features. And please understand, we say it with the utmost respect when we say they are kind of the lucky ones because we see that something's not quite right and we are able to get a diagnosis because they do have the facial features. It is the only thing that can cause the facial features is FASD. But see, mom doesn't even know she's pregnant yet. Mom is only going to find out at 6, 8, 10, 12 weeks, even 15 weeks, and some more than that. So lifestyle continues until mom finds out that she's pregnant.
Maria, are you able to touch on very shortly, of course, what the facial features may look like?
Okay, the facial features, what we do is there's a measurement that is done of both eyes and then the space between the eye. So it's as though we have like 3 eyes. It's very equal, all of us. But if the child has the features of the eyes, it's not equal. It's different amounts. Okay, and then we look at the upper lip. It's very thin. And we look at the space between the upper lip and the nose, which is the philtrum. And a child with FASD with the facial features, it's very smooth. There is no these 2 lines that we all have.
Oh, okay. Now, are you able to, or did children keep those features? Let's say, they weren't diagnosed, you had no idea. They're now 12, 13. You're now suspecting FASD due to the behavior issues, et cetera, learning, academics. Will those features be the same through growth?
Yes.
Okay. Thank you.
Okay. So responding to the unique complexities of FASD, we say that it takes a community to raise a child. Well, if it's a child with FASD, you need a big community because you need a lot of support and help. So we know that the social determinants of health need to be considered, the intergenerational impacts, compounding stigma, environmental adversity, co-occurring health conditions, and unique caregiver and family experiences. So it is a brain and body-based disability stemming from the prenatal alcohol exposure. So the primary disabilities that you see are the academic achievement. That's one of the things that is tested at our clinic: adaptive behavior, affect regulation, attention, cognition, language, memory, motor skills, executive function, and neuroanatomy, and of course the sensory. A lot of our children have sensory challenges. So the consequences of the maladaptation. So if we don't provide the services that they need, we call them the secondary conditions, which they struggle with a lot, is mental health, education, suicidal thoughts, suicide attempts, drugs and alcohol. I can't see the others, but you can see it from the chart. So justice, incarceration, and inappropriate sexual behavior. And a lot of them struggle with alcohol and drugs because they want to belong, they want to be a part of, and they are so easily led. The anxiety is so high and the self-esteem is so low.
I do have the same person that was making the comments about not having confirmation of alcohol consumption states that their child does have the facial features. They have been referred to the Center of Excellence, but still no, quote, diagnoses. I don't know if that means they're on the wait list or not.
I don't know how old the child is. If the child is very young,
They are.
They only have one chance to come to clinic. So we want to make sure that we do it well. So we usually wait until they start school, where they start to have more symptoms. So then we can really be very thorough and have a really good report. So because it's for a lifetime, they're only going to get one chance to come to clinic.
Oh, wow.
So
that's good to know.
yeah.
I didn't know that.
Yeah.
Thank you.
So we want to make sure we do it well. So usually we don't bring them until they're like 7 or 8. And we do know, we do say that the younger they come, the better it is. However, if you know that the child has the facial features, that means we know the child is going to get a diagnosis of FASD. It's important to start using the strategies and to really start looking. I find parents can be really good detectives of catching, you know, your child so well. Once you really start to understand FASD, you're going to be so good at it. You're going to know what your child needs. So what you see is not what you get. It really is at this maturity. So if your child, let's say, is a chronological age of, here it says 18, different parts have different developmental abilities. So reading skills here are 16, the living skills are 11. Money and time concept are 8. Social skills are 7. Now this child is 18, probably graduating this year, going into an apartment, will probably get, if he goes to secondary school, he would get a student loan, could get a credit card and pay rent. How successful do you think that is going to be with a child that has that dysmaturity? And that is pretty typical of our children with FASD. So instead of addressing the underlying cause of FASD, which is neurobiological changes in the brain brought on by the alcohol exposure, our focus is on the secondary symptoms. That is what we want to avoid. We want them to be successful. We want them to do well. So that's why it's important to have that support at all times. Are we ahead of our?
Yep, thank you, Maria.
Okay.
So before we hand over to Tanya, I just wanted to say to just ask the participants to bear with us. We're past our half mark time there, and we might run over a little bit. Now, we do have Joseph online with us. He is an individual with FASD, and so as not to heighten anxiety, we're going to ask you to just give him some time when he's presenting, if you don't mind, if it's not a problem. If you do have to leave, we understand, but we're just running a little bit over time there, okay?
And that's okay. I think that normally what we allow for is like the hour for the presentation and a half hour for Q&A afterwards. So most people would be prepared for tonight from 8 to 9:30 anyway.
Okay, all right.
So that gives you
We're in time. We're in
now.
time then. Go ahead, Tanya. Thank you, Kim.
You're welcome. Oh, you're on.
Oh, no, no,
Maria.
it's okay. It takes me a minute to go there.
Okay, before Tanya gets started, I see there's a question.
Yes, I didn't know if you wanted me. It says
And
we're
I know
having.
Nadia is here, and Nadia is kind of our sexual expert.
Okay.
So I wonder if she could answer.
Yeah,
speak
I'll
to
read
that.
it off to you, and Nadia, I'd be happy if you could take it. It says we're having difficulty with being easily led by peers and very defiant with adults. I also, sorry, I lost it there. I also don't know how to ask this without being blunt. They masturbate and make sex noises often. I'm concerned about abuse, not sure what is normal.
And this child is 5 years old.
Did I miss that?
Mine is 5
Okay.
and masturbates and makes
Okay.
sex noises often. I'm concerned about abuse, not sure what is normal. So Nadia, do you want to take that one? Would you want to?
Yes,
Thank
I
you.
will do that. Thank you for your question. You know what? You're saying it's very blunt. I'm actually very happy that you had the courage to say that question in a group. Thank you so much. It is not uncommon for our children diagnosed with FASD to have inappropriate sexual behaviors. It is something that we see at 60% of the time with our kids. And I'm going to give a very short answer for something that should be much longer than this, just because of the time that we have. The psychosexual development for a child diagnosed with FASD is very, very different than a typical child. So what I would recommend is reach out to us, reach out to the Center of Excellence. We now have a training, especially for the psychosexual education of a child diagnosed with FASD, that could give you more tips and tricks and understanding of what's going on and what to do to keep your child safe from himself, others, and etc. Because I think you're onto something. I think it's very important, but I think you should reach out to us. And if you need a specific training on it, I'm sure the coordinator in your region could get in touch with me. We could meet all together online and do something about it.
That sounds excellent. Thank you so much. And absolutely send me it if you can't get to Nadia's email address yourself. We have it available for you. We have one last question before we move on, if you don't mind. It says, what is the current wait time for a referral?
It's long. We don't like to say how long it's going to take because every child is so unique and different needs and circumstances. Because of COVID, we did have challenges. Like does anybody want to touch that question?
Okay,
Go
so
ahead,
I
Nadia.
think that you answered it perfectly. The wait list is long. We have diagnostic clinics 24 in a year, approximately 250 babies born in New Brunswick a year. So math there, it makes it long. The encouraging fact is that once your referral is in and we have the confirmation of alcohol and et cetera, you start working with your coordinator and they put those strategies and help you put strategies into place and work with the professionals that are in your team. So therefore, that kind of gives you some tools while we're waiting. And also, like Maria had mentioned earlier, we had received some funding. So maybe in the future, we'll have those satellite clinics and stuff. Go ahead, Maria.
And don't be afraid to reach out to your MLAs and complain.
Exactly.
We
Yeah,
encourage that. That's how we'll bring change.
I do believe the same person who asked that said, mine is being seen by Dr. Murphy, and we are expecting possible referral to the clinic. So
that would be, if you're in the St. John region, that I would be your coordinator, and
there you
because
go.
Murphy is in my region. So
There we go. Well,
I
thank
don't
you
know
for
if she
answering
sees
those.
throughout, but
There was another part to that question where she was saying we are having difficulty with being easily led by peers. And
Yes.
they want to make friends so much that they are very easily led. And yeah, that's common with our clients with FASD, and being very defiant with adults. They struggle with rules. They struggle with, it's that lack of understanding. Always think of everything that the brain needs to do just that. Every little thing, whether it being controlling emotions, whether it's being understanding social skills or reading body language. Those are all things that the brain really works at trying to process. So
And we do have Joseph online who will explain what, give you more of a life touch on what it is like to live and to be or to have been diagnosed at a later stage in his life with FASD. So he'll give his experience shortly after Tanya.
so we'll let Tanya.
okay, thank you. Just before I get started, Joseph, I want to just do a check-in. Are you doing okay? Okay, good.
Yeah.
So I just want to make sure everybody can see that, okay, huh? All right, so tonight I'm going to share the story of a boy named Ben, and he is my almost 13-year-old snappy redhead, and he came to us by the gift of adoption. And I only have a few slides here tonight. This is a project that I've been working on kind of separately in my spare time. However, it's not complete, so you're getting a little sample, a little taste of it. So in brief, our story is that I was married young and expected to have a family kind of right off the bat. And I was going to have a house full of kids, and I was married young, and that's how life was going to be. But little did I realize that that's not how life turned out, that I wasn't able to conceive. So therefore, we started into the road of fertility. And through the road of fertility, of course, my husband, my late husband, he was fine. So it was me, and I started into in vitro and all of that stuff. And for those who are adoptive parents, maybe that's a road you went down. If that's a road you were down, then you know the struggles. And nowhere in that point of the fertility clinic did the doctor say, maybe stop drinking alcohol. And if you're going down that road, you may be ingesting a little bit of alcohol, a little bit of wine or something along those lines. He made sure, you take your fulvic acid, you do your temperatures, but never stop drinking. And I didn't know anything then, but as I do today, which I don't know, we learn every day on FASD, but I knew nothing about FASD at that time. So then we were gifted our son, my late husband and I, through the gift of adoption. However motherhood comes to us, it's a miracle. And for that, when we took on the opportunity, and sometimes I say took on the challenge of being an adoptive mom, I really had an appreciation and a love for the bio mom, because going through that journey of not being able to conceive, and here this woman was able to gift me the miracle of being a parent. So my love for her and my appreciation was great. And as he was born, we were unsure of his prenatal health. She wasn't able to have many good visits or see appointments. So when he was born, this is our infant picture just home from hospital. And in this picture, this is a position that he slept in many times. And you can tell that he's not comfortable, and his chest is out in that back U shape. And it was his acid reflux that was giving him burning, and it was always discomfort. We noticed that he had a smaller head. He had a low birth weight. We were estimating premature birth, and he hardly slept. And I'm being generous when I say he's hardly slept. If I got 2 hours a night, I was doing well. and troubles feeding and eating were humongous. So for the first 24 hours, he was that perfect angel. The nurses were like, oh, he's beautiful. He's a little bit small. He was 4 pounds, 9 ounces. But you can beef him up, feed him in lots of love, right? That was the end all and be all. And that was going to be the answer, just lots of love. And I think back and I think, oh boys, was I ever naive. I had so many more tools that I really could have used at that time other than the love. But the gift of motherhood continued and he grew. And as he grew, the challenges became great. The sleep became less and less. The impulsivity became more. And the whole body started to have issues. So not only did he have severe respiratory problems as an infant and was on the ventilator and stopped breathing multiple times, he also has now asthma and his constant ear infections. And as we are now almost 13, we are dealing with dental issues because he will only ever have his 8 teeth kind of come in. And so now we're trying to save those 8 teeth because he has none that are coming in later on. And how do we protect those? And we're looking, at capping them so that we don't have to give him dentures or implants at his young age of 12. So it is a full body disorder. And those are the things that I didn't know. So I'm going through all of these struggles thinking love is going to cure all, but love wasn't curing all because the impulsivities and the challenges were increasing. But what I learned was that we depended on the services, which there wasn't a lot, but we had our first diagnosis of autism. And what we know with our kids is that many of our individuals and our kids will have many disabilities in many things. So many of them will have the autism or ODD or ADHD. So he was diagnosed very young with autism and ADHD. And we thought, okay, well, we can work with that because there's supports for autism. It's solely well known. And the ADHD, well, then we'll just slow them down and we'll teach them how to focus. But how do you teach somebody how to focus? Because that usually comes, we thought, remember, I was naive, I didn't know what I know today. And I thought I could just teach him to focus, just to look and to be calm. And I still didn't have enough tools. And it was when I was in a meeting with the behavioralist for the Autism Center, and she walked into the room and she said, he is not autistic, he is FASD, send him to the Center of Excellence. And I thought, now what? What's another diagnosis? So of course I do the one thing that as a coordinator I'll ask you never to do is get right on Google. Okay, Google, tell me FASD. And I, as a coordinator, I will ask you all not to do that. Please reach out to your coordinators if you need to know more information. And I was terrified. I was terrified. And I saw some of the stats and different things, and I thought, oh my dear Lord, now what? Right? And it led to needing to know more information. And we had to wait to get into the Center of Excellence. And I learned very quickly that I had to learn my way and navigate through the system. I had to get my people, my village. I had to create that circle, that wraparound approach for him and for I. And he got his diagnosis very young from the Center of Excellence. He was right around the age of 6, and my husband had just passed a year before that. So I'm trying to balance all of this and all of his struggles and take care of my sick husband at the same time. And I questioned, God, what the heck are you doing? Right? And it says that you're not supposed to do anything that you're not, that we can't handle. But I was sinking. I was a sinking ship. And I had this baby. I had my miracle, my life. I finally got to do what we envisioned, because as adoptive parents, we envision, we have hopes, we have dreams, and we have traditions that we want to pass on to our kids. And this was my opportunity. This was my chance to have what everybody else around me was having. So it was my turn to have the baby showers, my turn to go to Little League, my turn. And now I have a child who can't even sit still or know how to say, I love you, Mom. And that's all I craved for. So the first thing, the first tool, the first strategy, the first aha moment that I had to really learn before I built my toolbox was to learn that grief was real. And we don't talk about grief enough. And if you know me at all, and I mean, Nadia, I'm so glad that you're on this call. If you know the two of us at all, then you know that we're in the process of putting some videos together. And this is going to be one of our hard topics. Nadia and I like putting things out there in the raw and the real. And so the mom who said it's blunt, we love blunt. Because we as a society, we as a community tend to overcomplicate things. We really need to see the world as our kids see it, because our kids are so concrete. That's the beautiful thing about FASD, which I didn't learn till later on, which is just about a year or two ago, is that it's beautiful that they're actually so concrete that they forget how awful the day before was. So when they wake up, it's a brand new day and they say, good morning. And you're like this, and you're like, huh? Yeah, it's a great morning. Do you not remember yesterday? Right? And if we could just be more like that, the world would be a better place. So that's another tool. But my first tool before I even had the diagnosis was I had to learn grief. I had to go through those stages, the denial, the anger. Oh boys, was I mad? Was I ever angry? If you talk to the babysitter that I have presently, still, God love her, she stayed with us. We call her Jenny B. And she said, Tanya, you were such a mom. You were so defensive. You were angry. I didn't even like talking to you. And now I'm not that. And why am I not that today, but I was just a short 6 years ago? It's because I've built my toolbox. And I use my tools on a regular basis. And as I'm going through my stages of grief, my denial and my anger, I'm starting to build knowledge. And knowledge is power. So when we understand better, we can do better. So as I'm understanding FASD, and I'm getting the diagnosis, and he comes through clinic and he has the full face. So he has FASD with sentinel facial features. It was the first time that I was heard. It was my first time that somebody said, this is it. We don't have a recipe, but we have some tools for you. And I said, give me all you got. But I also remembered walking out of that room going, how do I explain this? Because I never wanted my child to be labeled. I wanted people to think my child was mine. And I didn't want people to think that I damaged or I hurt, and how do I explain that and label this child? So then as Nadia and I became friends over the years, and now we're colleagues, we've developed this baby program, bio mom versus adoptive mom. So look for that in the next month or so to come out. And so part of my toolbox leaving that center of excellence with that diagnosis was, okay, so now what? My strategies that I needed. My strategies that I built was changing my language. My first step was the grief. My second was the language. And my language had to change. So I took the word behavior and I replaced it with the word symptom. Something so simple to do, but is so powerful. And the 5 stages of grief, even 6 years into this and being a coordinator, but I'm a mom first, I will still go through some of these stages of grief because our Christmases look different. Our first days of school look different. But what I had to do is patch into him and his strengths and the toolbox that I was starting to build. And I had to watch him grow and see just what he can do, not what he couldn't do. Because we as a community, we as society, and as a parent, or at least I was going on everything that he couldn't do, all the things that were taken away from me because he had an invisible disability that I couldn't fully understand. But when I made the mind shift and I changed my language and I started learning that I talk too fast and he can't understand everything that I'm saying, that less is more. As I watched him grow and I was able to see what he can do and not concentrate on what he couldn't do, then my perspective changed. and then things changed. And now I watch him run and play, and I'm just going to bring you along with me. So I'm going to my house. Okay. Can you guys still hear me? Because I unplugged my speaker. Kim, can somebody just give me a thumbs up?
Yes.
We can.
Go ahead,
Hear you. Yep.
So I'm going to bring you along with me, and I know I'm trying to be conscious of time and Joseph and things, but when we speak as a coordinator, that less is more, we really mean less is more. So I often get questions about what do you have in his room and things like this. Now his room is a little bit more full than it started, because remember, I'm using the strategies. I have my toolbox. So as I have my toolbox and things are changing and growing, and he's changing and growing, then he's able to handle a little bit more. But one of the traps we fall into as parents, especially as adoptive parent, we want to give them everything, don't we? We want the rooms to be all princess-like, all superpower-like, the best of everything, right? Because we waited so long for our miracle. And so one of the first things I had to do was look at his room. So I'm going to turn this, and I don't know what you guys can see because I can't see what you guys can see, but I'm going to go out of my slideshow. All right. So now I can see what you guys can see. So generally when he's here, this curtain is closed. So he likes it on the dark side because that light is super bright. His eyes are really sensitive. So when he's here, even if it's like at supper time or anytime, that's closed. A little bit of light comes in. His room doesn't have a dresser, right? The walls, this green was chosen. He wanted it like army because they have their own expectations too, right? As we as parents, but green was calming. And it's nature. And that is another tool that he does. So as I'm learning and watching him grow, I'm tapping into what is his strengths. What does he like? Because I got to build his day around what he likes to be successful. Not what I like. I like my coffee first thing in the morning. I like quiet, and he doesn't. His feet hit the floor and holy moly. So, but nature is calming for him. So how do I bring nature into his room? I bring nature into his room by a calm green color. Those stars were just added the past 2 weeks. He loves Pokemon. You want to teach him something, your individuals, your kids, tap into what they love. You can teach them anything. He knows how to spell Pokemon names, but he doesn't know how to spell his own full name, Benjamin, right? So Charizard, right, little Pokemon thing, watches him overnight to keep him safe because he's in his room by himself and he's so used to having people with him that he needs to feel secure. He needs safety when he's in that room by himself because he's not used to being by himself. So it's about tapping in even into the room when they're alone or when they're in that space in their bed. And the other tool that I started implementing very early is asking him to stop and ask. So in this case, for example, this is how I'll use it. This is his closet. He doesn't get to go into his closet without asking to go into his closet. So if there's something in there he wants, he needs to stop. Mom, can I go in my closet? And I can say yes or not today. When he goes into his closet, his poster broke. See, God only knows what you're going to find in here. I'm being very brave sharing you all my space, but so be patient. So in his closet is where his dresser is because it made his room be less objects in it. And I taught him to stop and ask for the closet. When we say 3 things or less to choose, sometimes we have to make the choice very simple. This outfit or that outfit. If you open up the closet and you say, what do you want to wear today? I don't know. I don't care. But when you open up a drawer and you say, what pair of pajamas? There's 2 pairs of pajamas. 2 underwear, right? He gets to choose. I'm taking that extra step out for him. He doesn't have to do that step. He's not ready for that step.
2 outfits. Because we're getting further along and he's doing so well, I've tucked 2 shirts to the back, but they're kind of like out of sight, out of mind, so that when he is making his choice of what he wants to wear, if he's having a challenging time or if it's a little bit of a struggle, then he can just grab one of the 2 options. I don't coach him. The other tool that I had to learn isn't so much, it was the grieving process, and I also had to learn to change my parenting expectations and change my way of approach. So I often say to people, if you see me in public, you're going to think that I am a drill sergeant, like Army cadet kind of thing. And it's because it's what he needs. So we as parents have to learn to parent in a different way. And that's really hard because we didn't want to have to do that. You know, I think back when my
Oh,
Lego for 10 minutes. And I said to my sister, will not be used, default speaker. Okay. Anyway, I said to my sister, oh, poor you that she gets to sit and play Lego for a whole hour and you get to finish a whole cup of coffee. Meanwhile, I have to coach my son to give me that 10 minutes in the morning to pour coffee and have that coffee. And that's something that as parents, we're always givers and doers and on the go, right? And we always give. But it's important that we take that moment for self-care and that moment when we're in constant coach mode, because in fact, raising our kids with FASD, you are in constant coach mode. You know, you're in constant corrective mode and those sort of things. And we can troubleshoot the best of anybody. We are the best navigators. And as Maria said earlier, we're the best detectives because it's a skill that we acquire and we learn very early. And in the past year, I have learned the technique to share with my son, it's okay that I need a minute. So instead of just always coaching them that they need a minute, they can do their deep breathing or their squishes. Find out if your guys are deep pressure or light touch. That's one of our therapies. That's one of our go-to things. And the other so it's okay. So now I'm teaching him to say, I say, Ben, good morning. I love you. Can you give me my 10 minutes for my coffee? And he says, okay, Mom, can I play my switch? My independent time. So that's how we communicate. So he gets independent time, I get my morning coffee, and it's okay to do that. Yeah, so there's some of my strategies. That's a little bit of a blurb into my story that I really don't get to share often enough, and I would like to share it more. Nadia, who is on this call, and I are working on a few projects coming out. We do have a Facebook group for that, which is called, and Nadia, she can put it in the chats, but it's called The Raw and the Real of FASD. So we kind of talk about strategies and different solutions, and we do it in a raw and in a kind of a real way. We're just blunt, everyday people, because that's our lifestyle. So that wraps me up, Lisa, and I hope I didn't run over too long. I tried to shrink it down for Joseph. Is there any questions or anything?
There is one question. I'm not sure if we want to go to Joseph first and come back to questions or just hit the question. What would you prefer?
Go with the question and then we go to Joseph so we don't distract him.
Okay. It says, is there different stages if a child is FASD but also has extensive trauma?
So I'm going to let Maria answer that, but just before she does, the different stages, and I meant to touch on that in my presentation, is I find it depends on the season that we're in, right? So the different strategies might work best in a certain frame, that the certain season, a certain time that you're in when you're learning and developing. when they're doing a new transition or something like that. Sometimes I go back to strategies that we may have grown out of. So I go kind of back and forth. Maria, did you want to touch base more on that, or Lisa?
Right. So with regards to the FASD and trauma, we're talking about two separate things here. We want to work on the trauma. So we need to identify the traumas. And we're going to work our way through those, as well. At the same time, we're working with the FASD, but it's not trauma from a different lens, trauma from ASD lens, or trauma from AHD, or it's trauma from the FASD lens. So depending on what the traumas would be, we're working on those separately. And it would be best to get a good understanding as to the effects of those traumas so that we can work on them from an FASD lens. You want to expand, Maria, or are we good with that?
I think I'd just add too that our children with FASD do experience trauma. Like their school experience is not always a positive experience. And if they had trauma before, it's like we are re-traumatizing them, if I can say, because school is not always a positive experience for our children with FASD because they are so misunderstood. So if your little Johnny is 8 years old and or even 16 years old, rather than be in high school, he should be in lower grades developmentally. There he could be more successful. So that's just my personal feel.
Yep. Okay, so Joseph, it's your turn. You're up next.
Hello, I am Joseph Munn here, and basically I'm here to talk about what it's like to live independently and what it was like to live with my adoptive mother back when I used to live up there. Basically, I diagnosed at 18 years old with fetal alcohol syndrome. I was late in the spectrum. And also I wanted to put a pointer out to what someone said about when their kid would wake up from a stressful day before and just be like, hey, good morning. Reality, we don't forget about the day. We just more or less put it in the back burner, try to forget about it, live that day, but all of a sudden, a year will pass, that day will come and hit you hard. Just giving you a heads up, because that happens to me a lot. But anyways, I forgot what I was going to say. The middle school and high school life during when I was in it was stressful because, yes, people didn't understand me. The friends that I would make would always try to manipulate me, get me to do things for them, or take advantage of me since I was easily manipulated. And yeah, that's for the school anyways. It's also hard with teachers when they'd say, oh, you're just fooling around. You're not special or anything. You can deal with it. And basically, it'd make it hard to go through school. There's been times where I've been like, you know what? I'm done. I ditch the day. Ditch a week. Ditch 2 weeks. I'm not your honor roll student at all because of that. But I know one thing. If it wasn't because of my adopted parents being there for me when they were, I probably would have just dropped out of school, be another statistic on the campus, basically. And I know since high school, I've been steadily employed for 3 years straight with different employment opportunities. As each one rises, I jump to it. Basically, I go with the heart of my drum. Drum of my heart, or however the statement's pronounced. Sorry, guys.
That's okay. You're doing great, Joseph.
And to be honest, the minimalistic lifestyle that she was also mentioning, it was working before for me. And then all of a sudden, stuff kept on coming into my life. Stuff kept on filling in. And then it ends up being too much of a burden. And then you get working for weeks on end. And then this stuff happens, like where you just have no motivation to pick up anything anymore. that happens way too often. And then you'll get the days that you'll be like, hey, I'm going to clean it all up. The next day, you're done. Like you have no energy. You'll be in so much pain because, as someone also mentioned about the bones stuff, I also get pains once in a while. Well, a lot of the while lately. Where it's like harder to move. I have to have compression sweaters, which is one of these right now. It's a compression sweater that goes around my skin just to stop it from feeling like I need to itch and scratch it. Because, you know, skin. Anyways, what parents should also know about us when we grow up is we'll put a lot of things on the back burner, won't inform you guys. And then through the years, it will eat us away, causing more depression, more chaotic natures. There will be a change of your personality eventually. It's not if it's going to happen. I've noticed most of the people that have been diagnosed with FASD usually go through a week spurt of where their personality will alter from the stress and stuff, but some people will rein them back in. Some people will let them go and figure it out. It's all up to what you guys would like to decide. Personally, try pulling them back in. Don't let them figure it out. Because we've seen what happens when people need to figure it out. And I really don't know what else I should say.
Joseph, do you want to give a little bit more insight as to, because you did your job interviews independently, correct? You job on your own, you went for your job interview, and you're living independently, except that you do have a worker that comes in, right?
Yes, I do. And about the jobs, interviews and stuff, I did try to get some help with it through social development to try to get a job applications out, do the whole social development stuff. And then I just fell through the cracks because, hey, I'm normal. Hey, you don't have a disability. So they wouldn't help me. I ended up just being like, you know what? Drop the ball on me. Peace out. And I went and got my job within literally 2 days of saying screw it to them.
Do you want to talk about your notes, the notes that you take with you?
The what?
Your notes. You take your stuff down so you can remember.
Here, I'll just show you.
Yeah.
Test 1, 2, 3.
Yes, we can hear you, Joseph.
Okay, just more or less I took it off the stand I had it on.
Okay.
All right. I have this before I head out, the grab before you go, open your curtains, because as she also mentioned, lights hurt me. I tend to keep my lights down low right now. They're up high to enhance video, but basically keys, charge phones, grab my phone, change mask if I was still in COVID breach. And then over here, don't mind that little drop zone. That happens a lot. You'll notice that. When I'm putting dishes away, I have mugs up here, cups down here, plates, bowls. Like I label everything to try to get it up. Even within the bathroom, I have cleaning supplies, the essentials, which are like medicine kits, medications. We won't talk about that. And towels. Somehow my scatterbrain ended up putting them over there, even though it's labeled up here. So be prepared for that, you guys.
I love that, Joseph. Can I ask you a question?
Ask away.
At what age do you think that a child with FASD or youth with FASD should be able to say they want their story told? like a lot of parents, like what I've said, my son, you've met my son, he has FASD, but sometimes I worry about telling his journey before he's ready for it. So at what age did you feel ready to be able to explain your condition of FASD and you're comfortable with that?
To be honest, that also varies from person to person. But from my experience, I would always like be in the spotlight when I was young, like trying to do acting career and stuff. Unfortunately, that flopped. But it varies. Roughly, people would like to start their stories being known around 15 years old. That's the typical like storytelling.
That's great. That is a good age. And I think, to be able to get their consent and then, let them feel comfortable telling their own story. You have a comment there from a participant that says, absolutely love the visual supports that you utilize. I love them too. I never thought of that, especially the one at the door. I love it.
Give me 1 second to shut that down. All right. And I also have this one in my bedroom, which is the before you go, grab my smartphone, charge the phone, make sure I have a full battery, light switch, close the curtains in here, and make sure the tag is in the back of my shirt because I tend to put them on wrong some days. The put on socks and turn off my lamp. I have a simple push button lamp that I wired up to be a button here instead of trying to turn it all the time. And for clothes and stuff, don't mind this mess. I'm sorry, you guys. I have it labeled as t-shirts are here, pants are down on the bottom, and sweaters and long sleeves are up top.
Wow. And Joseph, Alicia has popped in there to say, what about the help? Oh, sorry. It disappeared. Lisa, do you see that? The comment Alicia made?
What about the help from your support worker and your alarm clocks?
The alarm clocks, I have probably about 50 of them set to remind me about medications, brushing teeth, showering, getting ready for work, and getting like organized and stuff.
Yep. And how do you do your work independent, your job when you go to work? How do you do that independently? What are the strategies you use at work?
I usually typically show up 15 minutes before to either ground myself so that I'm get into the environment better and that I know what it's going to be expecting throughout the day compared to going in being like, there's 20 pallets. Scheiße.
I love that.
So when I know there's a bunch of pallets, then I can easily get them chewed through.
And we have a comment saying that another participant has similar notes in their bathroom with a bedtime routine, and that they love the strategies you're using.
Right in the bathroom.
Mm-hmm.
And hi, Tanya. I see your little wave emoji.
Yeah.
Okay. Guess you didn't need to say it.
It is a wave, but I just wanted to touch on and add to the question, I think, Kim, that you had asked about the age of letting their story be told, sort of thing. Joseph, you did a great job answering, but if I could just add a piece of that part would be also, we want our individuals to grow up embracing. Joseph has grown up and he's embraced his disability, and he's used, he that's part of who he is. It's like with my son, he's very young, so he was shaking the MLA's hands and doing videos for FASD awareness at the young age of 10 years old, and he doesn't have the vocabulary and he has such the impaired with the executive functioning that he doesn't have the ability to say, I'm not ready or whatever. And I needed him to embrace his differences. I had to get him to embrace his disability and bring that disability to be part of his life. So how do we do that? We make it okay to talk about it because we want to take the stigma out away from the FASD. We want people to understand it. So therefore we talk about it. So my son, I mean, he loves videos. He loves the pictures. He says, Mom, send a video to my people. So everybody that sees his video on social media, they're his people. And he doesn't have the ability to use the words and the understanding, right? And he'll often say, yeah, my name is Ben Walsh. My brain works differently. Mom, tell them the rest. And that's okay. So I just wanted to add to my 2 cents first with Josh's great answer to his question.
Great,
Thanks,
thank
Tanya.
you.
Go ahead.
Which that is also a good point to add that information will need to be pulled out of us because we give, how do I explain it? Thoughts to words are kind of hard to explain.
Mhm.
Just like we're doing for you today, like the moment. So yeah. Joseph, you want to talk a little bit about your talents and your postcodes, and you want to touch on that before we close off?
About my what?
For your postcodes.
Unfortunately, I haven't really done my full sport lately, but I've used to do competitions for aerial acrobatics, basically. And also, I remember someone saying about a army sergeant. That's what I used to be. I used to be in the 242 Franklin Royal Army Corps, Cadet Corps, and I used to be the drill sergeant.
Nice.
So it's funny that someone mentioned that.
Great.
Well, that's excellent. Lisa, thank you so much, Joseph.
Yes,
Problem.
and somebody has said we have similar notes in the bathroom with a bedtime routine, which works really well for our foster son.
Great.
Nice.
Right.
So
Any
I'll
more
hand it-
questions? Are there any more questions, Kim? Thank you very much, Joseph.
No, we don't have any more questions and we're good for time. We still have like 8 minutes left. So of course, if anyone has any questions, now would be a great time to write it in the chat and Catherine is going to read them out to you. Joseph, I absolutely thank you. I love how visual it was. I'm a visual learner, so I loved when you went around the room too, and so creative. And you can tell that you really have a great support network with you, Alicia being one of them, of course, but the fact that you're embracing it and using the supports, I think is phenomenal because that's a challenge I have with my son. So it gives me hope to look at you and to see all the things and the strategies you're actually using and that my son will do that one day too. So thank you, Joseph.
And Holly says, Joseph, I enjoyed hearing your story. Thank you so much for sharing. I also wanted to thank Joseph. It's helping teach me. I learn best when I learn experiences from first person from people having them. So it gives you a much clearer experience of what's going on. And also, as a mom of 2 kids who have different disabilities, who are 14 and 18, it's really great seeing the things you, Joseph, have incorporated in your life to live independently. So thank you for, it's very inspiring. So
it is. I think, Catherine, there might have been another question there. Is
yeah, there's
there?
a couple more. Just
Okay.
okay. Just like it moves on you sometimes. Okay.
I know.
What is the percentage of FASD that also have attachment disorder, Brad?
Okay, so we don't have that actual data. We don't have that raw data to present. However, based on the information we do have or we're seeing from our files at our clinic, we have an high number of attachment disorder, RAD, ASD, ADHD. And remember, what happened is before they get diagnosed with FASD, sometimes the clients would get a diagnosis prior. If they're at school age, they need a diagnosis to get help. And oftentimes it's a misdiagnosed oftentimes it's misdiagnosed. Therefore, getting that diagnosis is important. So parents hang on to the one straw they have. This is the way to get help. This is what I'm going to do to get back.
Can I like hazard a guess? Like you know, most kids who come from care, they have, it's in their best interest safety, like people have been scary. So like if kids with FASD are coming from care, it makes sense that there's attachment stuff going on because it's been self-preservation. And not to speak as somebody with a disability, because I don't, but having watched two kids with disability, one from care and one not from care, having a disability in itself makes the world confusing, scary, so it makes attachment that much more difficult.
It
Thanks
does.
for adding that, Catherine.
So let me see. Okay, so Joseph says the notes are extremely important for when I can't get my thoughts straight.
That's
is
right.
really
And
important.
that's his notebook. That's a little notebook that he carries around with him.
And Carrie has asked about, is it ever diagnosed as ODD?
Yes, yes. And that's another, that's another misdiagnosis sometimes,
Yeah.
right?
We see
So-
that a lot, don't we, Kim?
Yes, we do.
Yeah.
So if that's it for the questions, I know we have about 4 minutes left. I just wanted to touch on one more thing. I think Tanya is going to talk about it, but just before she mentions it, I do want to say thank you to everyone that came tonight and participated either as a participant and or as a speaker, Center of Excellence and Joseph Munn. We truly appreciate it. If you have any questions that you would like us to forward to them, please send them to our emails. You can go find us on Facebook, or our telephone numbers or the website at www.nbadoption.ca. So I'm going to leave it there. Tanya has about 2 to 3 minutes to tell you about the upcoming events that are happening tomorrow night. Take it. There you go, Tanya.
Thank you, Kim. So tomorrow is September the 9th. So in our world, it is an exciting day. It's like Christmas Day for us. And we spend a lot of time prepping and preparing, all the coordinators across the province. And we spend all year and a lot of time close to it prepping and preparing. And so tomorrow, there are 2 activities to highlight. And one is there's an FASD awareness walk taking place in Fredericton. They start, I believe Alicia and everybody is starting at City Hall in Fredericton and going to the Legislative Assembly. There will be a table set up at 5:30. So if you're in that area, please partake. We do wear red, so we wear red shoes or red shirts. I tend to do both because it can match best. On the table is my red shoes and Ben's, and he thinks they're cool, and so that is the one day of the year that we get to like scream it from the rooftops and throw it all over social media. There is many places throughout Canada that is lighting it up red. I think it's City Hall in Fredericton that is lit up red. CN Tower will be lit up red. Niagara Falls is being lit up red. There's places out in Alberta that's being lit up red. St. John will have their walk for awareness starting at 6:30 at the Market Square Lighthouse. And it will be going along the Harbor Passage, finishing with tables, and we'll have balloons as we did last year. There's snacks and treats for all that attend. It's going to be a great time, and it's a great day to really, as Maria mentioned earlier, to kind of reach out to your MLA, let them know. I did that today. I was on 2 meetings with an MLA, coaching them, and with the City of St. John to do some work with them. So it's our month. It's our day tomorrow, and the 9th month represents celebrating in September represents 9 months of pregnancy. So
Thank you so much,
exciting day
Tanya.
for us. So please join us. Wear red. You can drop a picture to a website. I don't know, Lisa, if you have that that you can quickly put into the chat, but you can share a picture on social media or to Kim, and she can forward it to us. And we'll love to see you in red.
And before, I'll give Lisa the last word there, but I think
Oh.
Alicia is saying that Fredericton will
Yeah.
also have snacks and refreshments, and some other organizations will be in attendance also. So Lisa, how would you like to close off tonight?
Yeah, and the Legislative Assembly will also be lighting up bread tomorrow as well. So I really want to thank you, Kim, and your colleagues for organizing this training tonight. Thank you very much. Thank you to the coordinators who assist with this presentation. Special thanks to Joseph, who took the time out to present for us tonight. It's very hard at this time, so I know he will be tired and he is going to be maxed out and ready for bed soon. So, because it took a lot out of him just to present, okay? So we will be having the French version of this presentation next week, and Nadia will be, Nadia is a bio mom, and she will be bringing her experience to you next week. Looking forward to seeing you back here, or for
Great.
those who are French.
That's excellent. Well, thank you very much. Again, thank you all to those who participated, and we hope you have a wonderful evening.
Oh,
Thank you guys. Oh, what?
And there's something
they asked about Miramichi, and they're saying not yet. Moncton is having a kiosk information table at University of Moncton until 1 tomorrow afternoon. We will also be hosting events at college and schools throughout the month of September.
Excellent.
And they said it for carrying the Miramichi, chat with Mrs. Conroy, MLA.
Oh, there you go.
There we
Okay.
go.
And we do plan on doing something in the month of September in Miramichi. Not tomorrow, but there will be something coming up. We're in
Thank
talk
you.
with social development, FYI.
Thank you,
Oh,
Maria.
okay. Well, let us know and we can help spread the word. Well, have a wonderful night, everyone. Thank you so much.
You're welcome. Bye.
Bye.